Thanks very much, Kevin, and thanks for that introduction. I'm going to talk today about some of the recent outbreaks that we have dealt with in Dublin. Mostly Dublin. I'll defer to an outbreak that was mostly in the south of the country, in Cork and Kerry, but it started in Dublin as well. And I think it probably sounds a bit confusing when we talk about measles being eliminated from Ireland, and I'm coming up here talking about outbreaks. But the measles we see in Ireland are considered not native, and that although measles hasn't disappeared, the cases we see are really associated with importations. So the presentation, this is the outline of the presentation. I'm just going to talk about some of the outbreaks we've seen from 2000 up to our most recent outbreak in Dublin this year, and thoughts about why we're seeing such outbreaks and how we can improve on them, and maybe different work we can do in the future. Suzanne has mentioned and Kevin has mentioned that we need a 95% uptake of 2 MMR vaccines for herd immunity. And you can see from the figure there on the left that we're not really reaching 95% for MMR. There are some areas that have 95%, CHO area 2 and CHO area 8. You can see in the diagram there, if I can use this. 2 and 8, but other areas are 90 and 91%, and that would predominantly be the Dublin areas, CHO 7, CHO 6, and also CHO 1. So on average, it's 92%. And this is the uptake, again, for the MMR at school age. And you can see this broken line is 95%, and we're coming in on average at 92%. So as Kevin has mentioned, even though we don't see measles much, measles is not a benign illness. Children and adults who get measles usually present with cough, coryza, conjunctivitis, a fever and a rash, and they can be very sick. And we've seen in our recent outbreaks in Dublin up to between 25 and 30% of the cases are hospitalised. It's also one of the most infectious illnesses known, and one person with measles can infect up to 18 unvaccinated vulnerable people beside them. As I said, it's not a benign illness. The complications we see range from ear infections to diarrhoea, pneumonia, the more severe complications of encephalitis, eye disorders, and also fatal brain complications that occur many years later. We do see deaths from measles. Fortunately, in Ireland, we have not seen deaths since 2000, but in Europe, there have been deaths. In 2018, there were almost 40 deaths in Europe, the majority of which were in Romania. So just this highlights again the infectious nature of measles, that one person can infect up to 18 unvaccinated people. And a further infogram from the ECDC shows the average age of cases of measles in recent years. And you can see the dark colour here, that in 2017, 45% of cases are over 14, and we're seeing a similar pattern in Ireland of older cases of presenting with measles. So Suzanne showed this diagram, and I just wanted to show again that in 1988, MMR was introduced to Ireland, and the 2 doses of MMR is effective in preventing measles. MMR is a safe vaccine, and it's an effective vaccine. So we're going to take a trip back in time and going to talk about a few outbreaks that occurred, concentrating on the year 2000 up to 2019. And I just want you to look at here, almost 1,600 cases in 2000, and back down here from 2012 on, we have had less than 100 cases per year. And I'll show how these have changed from the cases that we saw in the 2000s. So in the year 2000, there was an outbreak in North Dublin, and this was written up in journal by Dr. Jacqueline McBride and Dr. Mary McCafferty. And I think it was recently mentioned again on prime time by this paediatrician, who's now a paediatrician in Drogheda, but he was an NCHD in Temple Street at the time, and he spoke about the deaths and how sick the children are, and he said he remembered their eyes. But the figures from this outbreak, which was mostly in North Dublin, there was 1,407 cases, of which 355 attended Temple Street Hospital. 111 were admitted. They had a measles ward in the hospital. The admissions were for dehydration, pneumonia and tracheitis, and of these 5 were admitted to ICU. The median age of the children in this outbreak was 14 months. No child who was admitted to ICU was vaccinated. 25 of the cases had pre-existing conditions and 3 died. The 3 children who died were all under 2 years of age. 1 had a pre-existing condition. 1 was a perfectly healthy child who died of pneumonia there was measles in the house, and the 3rd child died a year later from the neurological complications of measles. But at that time, you can see the national uptake of MMR was 79%, and in North Dublin it was less than 70%. There was no school immunisation services in the area at this time, and also it was 2 years after the initial Wakefield publication, erroneous claims. So I just move on quickly to 2011 to an outbreak we had again in North Dublin, and this was written up by Dr. Gable Fitzpatrick following it. And in this case, we had 285 cases, 250 again in North Dublin, located mostly geographically around Temple Street Hospital and Ballymun. 24 hospitalisations this time, with the same clinical presentation: dehydration, pneumonia and seizures. This time there were no admissions to ICU, no deaths, and we found that the majority again were children a little bit older than previously. 92% were school-going children aged less than 19 years of age. The MMR uptake had improved nationally at this stage to 90%, but in the area of the outbreak it was still about 75%, but there wasn't a school vaccine service in the area at that time. So this just shows again that most of the cases were young, were school-going, and the median age at this time was 5 years of age. So I'm going to move out of Dublin just for a little bit, to my Cork roots. This was an outbreak that started in Dublin, but it spread down to the south of the country. It was traced actually to a male who was on a flight from Budapest, and he was sitting beside a person who had measles who was Romanian. This resulted in spread throughout the country, 40 cases. There was 10 nosocomial, and we were able to trace 4 of the case transmissions to international flights. This is just a graph from Dr. Peter Barrett, and it shows of those who had vaccine information available, 31 of 34 were unvaccinated. 19 were hospitalised. They were mostly hospitalised in Tralee Hospital, and the median age of these cases was 8 years of age. So just briefly then, I'm going to touch on 2 outbreaks that we had recently in Dublin, 2018 and 2019, and the work on these outbreaks was predominantly done by Dr. Ruth McDermott and Dr. Louise Marin. So this was an outbreak again in Dublin. It was set in the background of multiple small outbreaks which was throughout the country. You can see the figures. We had 66 cases this year, and this outbreak is a relatively small outbreak. Again, we can trace it to importation. In this whole case, in this outbreak, there were 17 cases, and again, the median age is climbing all the time. We're seeing more adults. The median age this time was 16 years. Majority of cases had not been vaccinated appropriately. And this case is interesting because this is the first case that presented that we became aware of. It was a child, a 6-year-old child, who visited hospital on an ED department on 3 occasions before was diagnosed with measles. It resulted in nosocomial transmission to 5 further cases. And once the child was diagnosed, there was a retrospective diagnosis in the child's mother of measles. The child's mother had been admitted to an adult acute hospital, treated for a viral infection, but was retrospectively diagnosed as measles, and her stay in the ED department resulted in 2 nosocomial transmissions as well. So this 7 out of the 17 cases in this outbreak could be traced back to hospital transmission. We've said that. And the other transmission in this outbreak was predominantly the north inner city to vulnerable, unvaccinated children in the north inner city. Okay, I'm going to have to speed up a little bit, I think. Okay, so finally, the last outbreak we have, which we have closed very recently, was again the importation of cases were from, we could trace from Lithuania, Poland, France, Romania. The cases were older. Again, the median age was 22. We could trace quite a few to the skiing season, to skiing in France, came back unvaccinated Irish who went abroad and transmitted when they came back. Any case of measles, we have to work very hard in all the departments. And the work related to the case, the family, we work with community health, the GPs, the hospitals. As I said, the cases can be very sick, particularly the adults. We find that they can be very sick, and we have a lot of hospitalisations. The effects on the family can be quite traumatic, as well as other unvaccinated being infected. We do recommend, and it's followed, that unvaccinated siblings are excluded from excluded from childcare in school for up to 21 days, and this is always accepted by the institutions we recommend. We work very closely with our colleagues in primary care and community care because they're always part of the OCT, the senior medical officers, the principal medical officers. They rejig their school immunisation schedule so that they can go in and give the MMR in the area that's affected. So I suppose what I think is the changes, we are still seeing measles in the vulnerable unvaccinated population, particularly in our case in North Dublin. And this, I think, is not an active anti-vaccine issue. It's probably more related to busy, chaotic lives. But what we're seeing new in our recent outbreaks is nosocomial transmission, delayed recognition of measles facilitating this nosocomial transmission, the unusual presentations in adults, like in that lady who was treated initially for a viral infection. We are involved in giving post-exposure prophylaxis to contacts, many travel-associated cases, and we have the issues with the social media and anti-vaxxers. I think I'm going to have to move on, Kevin, am I? Just how we're dealing with each of these issues. I'll say one sentence on each of them. Nosocomial transmission to healthcare workers. The advice is that each healthcare worker has to have 2 MMRs or a written documentation of immunity to measles. So this is work really for the Occupational Health Service. We have worked with our colleagues in GPs and clinical practice to try and increase recognition of measles, particularly in adults. We try and protect the vulnerable. They're the pregnant, the immunosuppressed and the small babies, and this involves a lot of work linking with the hospitals and the GPs to try and give this post-exposure prophylaxis. The travel, it's really hard not to crack stopping the importations, but if we can even work on the Irish people going abroad to ensure they're appropriately vaccinated and to try and get over this, there is a new recommendation that children between 6 and 12 months do need an MMR prior to be going abroad, and that's going to be funded. Kevin is nodding. That is funded by using the Outbreak, and your local departments of public health will link with that. Social media is a new problem, I suppose, we have to cope with, but also we've used it positively in our recent outbreak by geo-targeting messages to mothers in the North Inner City. And as Suzanne said and Kevin said, the healthcare workers, particularly those who work in the community, which are the public health nurses, the practice nurses, the school teams, they're the people who influence parents with scientific advice on the benefit of the MMR. And as the WHO has said, they remain the most trusted advisor and influencer of vaccination, and they must be supported to provide trusted, credible information on vaccines. So I know there's a peer-led school programme, there's plans for a peer-led programme to educate the practice nurses. Days like today, the National Immunisation Office has fantastic up-to-date information, so everybody can be educated to influence. And it has worked before with the HPV from the work of Dr. Brenda Corcoran and Anna, who previously published in The Lancet. So thanks very much.